Autism was first identified in the 1940s by Dr. Leo Kanner at Johns Hopkins. He identified autism as a disorder affecting social development, communication development, and behavior development. Autism is actually a subtype of a larger category of disorders known as the Pervasive Developmental Disorders.
Kids with ADHD or autism want to be independent. Try Goalie, the visual scheduler that guides them through routines so you don't have to. Goalie, reinventing routines.
And there are 5 of these disorders, including autism, Asperger syndrome, childhood disintegrative disorder, Rett syndrome, and pervasive developmental disorders not otherwise specified.
In order to differentiate between the 5 subtypes of the pervasive developmental disorders, one first has to look at language development. All have abnormalities of social interaction and communication. If there is language involvement to an extent greater than just communicative language or pragmatic language, then we consider the diagnosis of autism. If it is just involving pragmatic language, this is where the term Asperger's disorder is utilized. Rett syndrome is a very classic pervasive developmental disorder where a child, 98% female, has normal development until late infancy. At that time, there is a regression in their language, their interaction, and their play, as well as global cognitive or intellectual ability.
For families living with ADHD or autism, preventing meltdowns is everything. Goalie reduces stress by enabling kids to complete routines independently. Goalie, reinventing routines.
The childhood disintegrative disorder is very rare. Children have completely normal development up until the age of 2 to 2.5. Pervasive developmental disorder, not otherwise specified, is a diagnostic category that is utilized where symptoms of other forms of the pervasive developmental disorder are present, but not to the degree that they qualify for any of the 4 other disorders.